Well, June is Hernia Awareness Month, a time to shine a spotlight on a common but often overlooked condition. Now, joining us now is Dr. Sajida Ahad, a general surgeon at Mercy Cedar Rapids, to talk about the signs, risks, and treatment options for hernias. Doctor, thank you so much for joining us today.
Thank you for having me.
Yeah, absolutely. So we'll start with the basics then. So what exactly is a hernia and what causes it?
So a hernia is basically a protrusion of the internal organ or structure, usually intestine or fat, through a weakness in the body wall.
Absolutely. And so are there any certain risk factors or activities that make someone more likely to develop a hernia?
Yes. So the risk factors basically are connective tissue disorders, people who have had many pregnancies, people who do heavy lifting with poor technique, people who've had previous surgeries with weakening of their tissues, people who actively smoke are usually the ones, or people with family history as well.
Yeah, so what symptoms might indicate that someone has a hernia?
There are a wide variety of symptoms that patients may present with, but most commonly they'll feel a bump. Sometimes they feel a heaviness or a dragging sensation, especially if it's a groin hernia. Other times, if it's like a hiatal hernia, they may have reflux symptoms. They may feel pain associated with the hernia as well. So, and all of these symptoms may be present at the same time, or they may present subsequently.
No, absolutely. And so when is surgery recommended and what treatment options are available?
So there is no medical treatment for a hernia. There may be some conservative management for some time, if you want to buy time, but when there is a hernia, we usually recommend that the patient gets checked out so they can discuss with the surgeon all their treatment options. Now, currently at Mercy, we do have a self-scheduling option available to the patient. So if anybody is concerned that they have a hernia and you want to get it checked out, we have a group of fellowship-trained, minimally invasive specialists for hernia surgery that can counsel you on what to do next.
Yeah, absolutely. And last question here, doctor. So what advice do you have for someone who suspects they might have a hernia but has been putting it off to see a doctor?
Don't, because the consequences may be severe. These hernias can enlarge over time. They can get strangulated, requiring emergency surgery, and pose a threat to quality of life as well as morbidity, getting sick from the hernia, and even mortality, which means dying from it. So the earlier you get it checked out, the more of a plan you will have on what to do with a hernia.
Yeah, absolutely. Well, doctor, thank you so much for joining us today.
Thank you. My pleasure.